Assalamualaikum, good evening everybody, and I'm here again to discuss for you regarding under the category of high risk exposure of healthcare workers who are exposed on COVID-19. Yesterday I discussed all of the three, but there were some suggestions and there are some requests. If possible, I have to discuss it in English so that others may understand, and if possible, I have to discuss it according to category. Like from high risk, I have to discuss different medium risk and low risk exposure of the healthcare worker. So this evening, I'll be discussing the category under high risk exposed healthcare worker. So brace yourself. You have to wear your mask. You have to maintain social distancing. You have to maintain less droplet exposure and 1.5 meters away. Anyway, so we're about to start. Again, good evening. So our topic, as I mentioned before, it is about the management of high-risk exposed healthcare workers to COVID patients. Okay. Yesterday, I discussed about it on how they were categorized. But now I have to discuss it again, little one by one, and to make it clearer. Okay, how it was categorized into high risk exposure. Okay, according to the guidelines given by the General Directorate of Infection Prevention Control and by the Ministry of Health, a prolonged close contact of the patient and the healthcare worker, which is less than 1.5 meter of distance and more than 20 minutes, is one of the category that the healthcare worker will be termed as exposed to a COVID-19 positive case. So, epidemiologic risk classification of healthcare workers exposed to coronavirus disease patients or their excretions and secretions in a healthcare setting. So according to this drawing, according to this figure, there is high risk exposure if the patient itself is within 1.5 meter, within 1.5 meter from the healthcare worker, and the healthcare worker itself is not wearing any protection, not wearing any mask. Okay, so meaning the healthcare workers automatically will be is needed to have a swab, a nasopharyngeal swab. So from the Gdipc, this reference that I was discussing since yesterday is from the version 2 from the General Directorate of Infection Prevention and Control regarding management of healthcare workers exposed to COVID-19. So as you can see, this is the whole diagram. So once you are seeing this one, it makes you confused and as if you don't like to read it, but I have cut it into high exposure for today, and later we'll discuss medium and low risk exposure. Okay, so how does an high risk exposed healthcare worker are being managed? So as mentioned, it keeps on coming back on our minds and it's keep on rephrasing and it's keep on telling you that a prolonged contact which is close to the patient, which is less than 1.5 meter and more than 20 minutes contact with the patient, with a COVID patient, is a definition of exposed healthcare worker. So if yes, you are in contact. If no, you are not exposed. You are not exposed. So these are the no's. If a healthcare worker is performing AGP only with face mask and not with a respirator, so meaning you belong to the high risk exposure. And also, if the healthcare worker is not wearing mask at all, including the patient also, the patient is not wearing mask to contain the secretions. So again, the staff is exposed to high risk exposure. So what are the things that are going to do? There are two ways actually. There is a positive result and a negative result. So I will discuss to you first when the result of the nasopharyngeal swab the healthcare worker become positive, what to do. Okay. Here, once a confirmed case was contact traced and a healthcare worker was informed that you are one of the contacts of the patient. So, and as I mentioned before, of the two categories, if you are not wearing any mask, if you're performing AGP for the staff, for the patient, I mean, so automatically you will be restricted from work for 14 days. Okay, it's not a vacation. You'll be just restricted. So it's a 50-50 restriction. Okay, so and again, you'll be taken one swab. So you'll be taken a swab, a nasopharyngeal swab, upon 3 to 5 days exposure from the patient. Then after the 3 to 5 days exposure from the patient and the result came and it became positive, so the infected healthcare worker should be quarantined or hospitalized according to the case condition. If you are asymptomatic, automatically you'll be admitted in a quarantine center. But if you are having symptoms, you'll be hospitalized in a corona center. Okay, so this is positive. For example, a healthcare worker result become positive. So again, there is two categories. Either there is a symptom. If there is no symptom, a third day of the confirmation date, when your result came after third day from the result, you will be retested. A healthcare worker will be retested. Then when the result came up already and the result becomes negative, after 24 hours, another swab will be taken for you. Then if the result become negative, so good, you have to return to work. So meaning you are recovered. Okay? Then if the healthcare worker is having symptoms, which is yes, you will be retested or a healthcare worker will be retested after 2 days on after the resolution of the symptoms. When all of the symptoms of the healthcare worker is already resolved, so that's a time after 2 days you'll be tested. Okay, once it was tested and the result become negative, again after 24 hours, it will you will be retested again. You will have nasopharyngeal swab, and when the result came negative, so meaning you are recovered already. You can go back to work. But if this second sample become positive, then again it will go through the same cycle from positive, then infected, then again you will be taken two consecutive negative. So it's just a cycle. So if the healthcare worker exceeded their testing time and one negative sample taken after 5 days or more after exposure symptoms, and symptoms resolution is enough. For example, if more than 5 days you are being retested more than 5 days and there are no symptoms at all, one negative is enough as long as there is no symptoms. Okay, as written here below. As I told you, I discussed already the positive. Now, what if the result is negative? Are you free to go home from the quarantine because it's very bored waiting for the results or like that? Not yet. Once the result came negative, alhamdulillah, it's negative, you will continue your isolation for 14 days. If you are there in the quarantine for 6 days, still you have 7 days you still have 8 days to finish your isolation because they need to observe for any symptoms to come. Or if no symptoms, so it's okay. So monitor for any signs and symptoms for 14 days. Then you have to continue isolation. Okay? That's why, because as I told you, you have to continue. What if there is development of the symptom? Yes. So you'll be taken swab. If there is no development of the symptoms, so you'll stop the monitoring. After 14 days, you are free and you can go back to work. Okay? So again, once you were taken swab and you have symptom, again, you'll be taken swab. And if the results become positive, and again, you'll start all over again with the same cycle, which positive, then the infected healthcare worker should be quarantined or hospitalized according to the case and condition of the healthcare worker. So I hope it is all clarified and I hope it is according to details, according to your understanding. So next time, maybe not tomorrow, this Friday, inshallah, I will discuss on the category under medium risk exposed healthcare worker. So again, thank you very much for listening. I hope you learned something from my lecture. So see you this Friday, inshallah. Thank you very much. Assalamu alaikum.